Hello YouTube, welcome back to I the Pharmacist. Today we have an important topic to discuss that affects many of us at some point in our lives: hair loss. In this video we will explore how improving your diet may possibly help you in the combat against hair loss. Before starting the video, I want you to remember that this video content is made for informational and educational purposes only. It is not intended to substitute for professional medical advice, diagnosis or treatment. Always seek the advice of your physician or other qualified healthcare professionals if you have any questions regarding medical conditions. Thank you. So let's start. Firstly, while lifestyle modifications may not completely reverse hair loss, they can help maintain the health of your existing hair and support some medical treatments or interventions you may choose to pursue. One of the most important things is healthy diet. While diet alone may not be the sole solution for hair loss, as genetic factors and other underlying conditions can also play a significant role, a balanced and nutritious diet can contribute to healthier hair. So firstly, let's start with protein. Hair is primarily composed of protein called keratin. Consuming an adequate amount of protein is essential for hair growth. Protein is composed of amino acids. Specific amino acids such as cysteine and methionine are critical for hair growth. They contribute to the formation of disulfide bonds in keratin, which give hair its strength and structure. Adequate protein intake can help reduce hair shedding and promote a fuller head of hair. Good sources of protein include lean meats, poultry, fish, eggs, dairy products, legumes, and plant-based protein sources like beans and tofu. The next thing I want to talk about is iron, and iron deficiency may be a cause of hair loss. Iron deficiency might lead to a condition called telogen effluvium, where a significant number of hair follicles enter the resting phase of the hair growth cycle and eventually fall out. This can result in diffuse hair thinning and hair shedding. Incorporate iron-rich foods such as lean red meat, poultry, fish, lentils, beans, and spinach into your diet. It might be a good idea to combine these foods with vitamin C-rich sources such as citrus fruits, paprika, and mango, as this can enhance iron absorption. It's important to note that excessive iron intake can be harmful, so iron supplementation should only be undertaken with guidance from a healthcare professional. Remember, iron levels in the body should be determined through blood tests, and supplementation should only be recommended if a deficiency is confirmed and should be monitored by a healthcare professional. The next thing I want to talk about are omega-3 fatty acids. Omega-3 fatty acids, specifically EPA and DHA, are known for their anti-inflammatory and overall health benefits. Chronic inflammation can contribute to various health issues, including hair loss. Omega-3 fatty acids have anti-inflammatory properties and can help reduce inflammation throughout the body, including the scalp. Some studies suggest that omega-3 supplements may increase hair density and thickness, but the mechanisms aren't fully understood. Omega-3 fatty acids are found in fatty fish like salmon and mackerel, flax seeds, and walnuts. The next thing on the list is biotin, vitamin H. Biotin is a B vitamin that is essential for hair health. Biotin is involved in the production of keratin, a protein that makes up hair, skin, and nails. Biotin is more likely to be effective in addressing hair loss when it is caused by a biotin deficiency or certain medical conditions that impact biotin metabolism. Biotin supplementation may not be as effective in addressing hair loss due to genetic factors or hormonal imbalances such as androgenetic alopecia, male or female pattern baldness. Foods rich in biotin include eggs, nuts, seeds, sweet potatoes and whole grains. Biotin supplements may also be beneficial if you have a deficiency, but consult a healthcare professional before starting any supplements. The next topic is vitamin D. Vitamin D may be important for the growth and maintenance of healthy hair follicles. It is believed that it can play a role in the production of new hair cells and in the hair cycle and hair follicle regeneration. Some studies have associated with low vitamin D levels with certain hair conditions including alopecia areata, telogen effluvium and male-female pattern hair loss. These associations do not necessarily imply that vitamin D deficiency is the primary cause of these conditions. First of all, let's talk about androgenetic alopecia. Here is a review of available literature that explores the causal relationship between low serum vitamin D and androgenetic alopecia. And here is the conclusion of the review. You can read it yourself if you want. And now moving to the next one, alopecia areata. Alopecia areata is a hair follicle specific autoimmune disorder. And actually, this review and meta-analysis explore the increased prevalence of vitamin D deficiency in patients with alopecia areata. And this is the conclusion of the review and meta-analysis. You can read it yourself. And the next question is how you can get vitamin D. Usually you can get vitamin D from exposure to sunlight and dietary sources like fatty fish, fortified dairy products and supplements if only necessary. It is important to note that the evidence is not yet strong enough to recommend vitamin D as a primary or standalone treatment for hair loss. Remember, if you suspect that low vitamin D levels may be contributing to your hair loss, or if you have concerns about your vitamin status, it's advisable to consult with a healthcare professional. As healthcare professionals can conduct blood tests to determine your vitamin D levels and provide guidance on supplementation if necessary. And now we are moving to the last chapter of this video, zinc and selenium. These are essential minerals that play a role in maintaining overall health, and they can also have an impact on hair health. While they are not a guaranteed cure for hair loss, ensuring that you have an adequate intake of these minerals can be beneficial for maintaining healthy hair. Let's start with zinc. It plays a crucial role in cell division, including the cells responsible for hair growth. Zinc helps regulate hormone levels, including those related to hair health. Hormonal imbalances, as we know, such as excess dihydrotestosterone, can contribute to hair loss. Zinc is known to help maintain a healthy scalp also. Zinc-rich foods are red meat and seafood, such as oysters, crab, lobster, nuts and seeds, pumpkin seeds, cashews, dairy products, milk, yogurt. The last one on the list is selenium. It is an essential component of various antioxidant enzymes in the body, including those involved in protecting hair follicles from oxidative stress. Selenium is also necessary for proper thyroid function. Thyroid disorders, particularly hypothyroidism, can lead to hair thinning and hair loss. Selenium-rich foods are Brazil nut seafood like tuna, sardines, eggs, whole grains like brown rice, whole wheat bread. While zinc and selenium are important to hair health, it's essential to obtain them through a balanced diet or supplements if necessary. However, it's important to note that excessive intake of these minerals can also be harmful and may lead to adverse effects, so you better consult a physician before taking any supplements. Okay, this was the end of the video. I hope you find it informative. Please like it and subscribe to my YouTube channel for more health and fitness related videos.